Doesn't surprise me, but it does worry me. In 2050, dare I say that I'm going to be one of those elders that might be affected.
With September being World Alzheimer's Month, many Montrealers and Canadians know someone who is struggling with the disease. The Alzheimer's Society of Canada estimates that the number of people living with dementia is expected to increase to 187% by 2050. Among Indigenous populations across Canada, it's much, much more, with Indigenous statistics showing their increase to 273% now. The percentage for Canadians represents the general population, while the 273% is only among 10,800 people of Indigenous ancestry living with dementia. The percentage increase is still significantly higher, with some calling for more education on risk factors and ways to help their quality of life.
We really, really have to empower people with as much education, not only about the disease, but once again, to understand the resources that are available in the community.
Claire Webster is a certified dementia care consultant and works in collaboration with McGill University. Since July of 2023, the McGill University Dementia Education Program has been working with the Cree Board of Health and Social Services to provide dementia education training. Webster recently visited Chisasibi and Wemindji to educate the communities about risk factors.
It was very, very important for them to understand the illness. Many of them had this, as I mentioned earlier, it was the first time that they were ever being provided with an opportunity to understand, like, why is my elder behaving the way they are?
According to the report, there is a continued lack of information on dementia, with many risk factors in Indigenous communities being diabetes, hypertension, trauma, and lower levels of education. Robert Bonspiel of the Mohawk Territory of Ganassadage and president of the First Nations Paramedics Services says dementia is fairly common and is not something discussed as much as it should be.
I think it's only going to exacerbate the situations. I don't, unless there's a cohesive approach to education within the communities to understand what people should be looking for, when they should become concerned, and when they should request for medical evaluations of their loved ones. Until that happens, I think that we're really in a slippery slope here.
Bonspiel says it has become increasingly common to receive calls of elders in distress with Alzheimer's and dementia. He and Webster believe more awareness should be shared for the sake of future generations.
So it doesn't mean that because you have a diagnosis of dementia, life is over. There are all kinds of things that you can do to really try to, live your best life.
In Montreal, Tehosterihens Deer, City News.
Next on City